Thank you for joining us for this Targeted Oncology Virtual Tumor Board, which is focused on acute myeloid leukemia. In today's Targeted Oncology Virtual Tumor Board presentation, my colleagues and I will review 4 clinical cases. We will discuss an individualized approach to treatment for each patient and will review key trial data that impacts our decisions. I am Dr. Naval Davar, Associate Professor in the Leukemia Department at the MD Anderson Cancer Center in Houston, Texas. Today, I'm joined by Dr. James McCloskey, Chief of the Division of Leukemia and member of the Adult Blood and Marrow Stem Cell Transplantation Program at the John Theriot Cancer Center of Hackensack University Medical Center in Hackensack, New Jersey. Dr. David Rizzieri, Professor of Medicine, Chief of the Section of Hematological Malignancies, and Associate Director for Clinical Research in the Division of Hematological Malignancies and Cellular Therapy at Duke Cancer Institute in Durham, North Carolina. Dr. Olga Weinberg, Director of Hematopathology and Flow Cytometry in the Department of Pathology and Assistant Professor of Pathology at the Boston Children's Hospital and Brigham and Women's Harvard Medical School in Boston, Massachusetts, and Dr. Usama Gergis, Associate Professor of Clinical Medicine in the Division of Hematology and Medical Oncology at the Weill Cornell Medical Center in New York, New York. Thank you for joining us. Let's get started with our first case. So Dr. McCloskey, if you would like to discuss our first case, which is a FLT3 mutated acute myeloid leukemia, please take it away.
Thank you. So our first case today is a 44-year-old woman who comes into her primary care physician with flu-like symptoms and fatigue that she says had been present for around 2 weeks. Prior to this, she was healthy and had no remarkable past medical history. And upon workup, the primary care doctor notices that her WBC is elevated, so 65,000 white blood cells. And they note that there are blasts observed in circulation. The patient is thrombocytopenic with a platelet count of 45,000, anemic with a hemoglobin of 10, and borderline neutropenic with a neutrophil count of 1.1. Her other labs are fairly unremarkable, and she has normal liver function, kidney function, and her cardiac exam is also normal, including an echocardiogram that shows an intact ejection fraction. The patient undergoes a bone marrow biopsy that shows 65% blasts. Her cytogenetics return, and these are normal. Molecular testing is sent and confirms the presence of an NPM1 mutation. The patient is also noted to have a FLT3 ITD mutation present at a low level with an allelic burden of 0.28. In addition to these mutations are observed in TP53, ASXL1, and RUNX1 is noted to be wild type.